In hospitality, there's a lot more urgency in how quickly you get a cup of tea compared to
a hospital.
Yes. So that's what was the big cultural shift for me, and say, okay, how do we bring back urgency and sense of care? Soft skills training is missing in most of these training institutions, largely. So they'll have to learn it and pick it up from the workplace. And then you must remember something else, a word which is called healthcare used to be a calling.
Yeah.
So people in their heart wanted to be nurses. People want to be priests. They want to be nuns. People are taking professions because that's what brings bread and butter.
Welcome to Daktari Tone, where voices, perspectives, and sounds relating to healthcare practitioners and matters health are amplified. This is a podcast by Daktari Online, created for healthcare professionals across Kenya. Each episode brings you honest conversations, expert insights, and real-life stories from the front lines of care. Welcome back to another episode of the Daktari Tone podcast. With me, I'm still joined with Gordon, whom we got to learn a lot about his journey in the healthcare leadership and personal takes around him managing greater decisions around the same space. In this episode, we're still going to continue around the leadership, his leadership styles, and his take on healthcare effectiveness. Okay, so any other big mistake that became a big lesson to you?
I think sometimes not carrying everybody with you, and so you make assumptions that, and so we used to do a 360 degrees feedback, and somebody wrote very clearly that one of the words I used to like saying in meetings is because I'm miles ahead of everybody, and somebody would make a comment, and I would say that is a no-brainer. So he says, you're not allowing other people in the room to also be on the same wavelength. It may look so simple, so straightforward. Yeah. So you learn that sometimes you need to just allow that process to go through. Okay. Otherwise, it can be demotivating and to other people.
It may seem more of you being. There was these times we used a boss than a leader.
Yeah,
it would give that. But then I feel like being still a leader, you have to have both of them so that you can set a limit.
Yes.
That is my belief. I might be wrong, I might be right. But also, in the fact that you also mentioned that the fact that you are carrying everyone everywhere, I also have a version for that, where I always say, sometimes people are brought to your space at that moment and maybe at that version of you to reach a certain place. And when it's done, you just have to let go. It'll hurt, it'll break, but then you're also allowing them either to also go further, and maybe you holding them is also still holding them back, and it also allows you maybe to also go further and learn more and also touch more other lives.
Exactly.
Yeah. So now, this is my last question for you. If you could give every hospital leader, one management practice to adopt today, what would it be?
Well, that's not because there are many things in there.
Just choose one. One that stands out to you, and then also relatable to now what you've understand now with the healthcare.
But to me, I just think transparency is the biggest thing, because and when I talk about transparency is numbers, So if you sit with your management team and you do the reviews properly and you say, okay, how are numbers? What's our patient volumes? How these patient volumes? What is it costing us to get this patient volume? You've got to be very clear also about how you monitor and pick up complaints and also address them. You've got to look transparently at your revenues, and then at the end of the month review whether or not you're actually covering your costs. But then you have to let every single person in the organization know how your performing.
Yeah.
Because then you can motivate them and tell them, look, things are not going well, and so we need to tighten our sequence. It's not so you don't leave people behind, and so trying to find out communication mechanisms that information can be flowing from the top to bottom and eliminating the grapevine, as it were, because the people can seek more information from what is not true than what is reality.
So one thing I'm getting that cuts across from the intro to now, which I feel like it was more that touched you during your health leadership tenure, is numbers, and fact that sometimes workmanship can be lower, or even revenue can be so tasking, and you are well aware of it. And other than just having the rest of the staff and even the support just knowing that we are well or we are doing well, and that now burdens, maybe one side can be really taking the toll.
Yes.
You make sure, this is my assumption with the conversation I've had with you.
Yes.
You, other than just having one party to suffer most, you had to bring the whole team together. Because even I think you gave a practical example where you even bring all of them in the boardroom and you tell them this is what is happening, this is how we are at, this is where we are at. But then as much as that's where we are at, there's a standard we've already given of how we offer our services. And remember who is our client, it's the patient, and so their needs are what comes first. So how can we do to either stay where we are at, which is best, let me believe, or better, or go higher regardless of where we are at. You didn't have to say it directly, but that's how I'm getting the whole conversation, because as much as it's different questions, it all circles around you, and that's more of just a leader. That's my take.
So let me ask you, do you perceive hospitals to be dirty or clean?
Hospitals are clean.
They're clean?
Yes.
And you expect them to be clean?
Yes, I expect them to be clean.
So the most interesting experience I had was that people think hospitals are dirty. So to reach my office, where I used to work then at the Gertrude Hospital, the entrance and the walk through the hospital, it takes you walk through the hospital as a visitor. And whenever I welcome people that sit down, the first compliment they tell me is that your hospital is very
beautiful,
clean.
very clean.
Yes. And I used to be surprised because that's a minimum non-negotiable.
Actually, it's a bare minimum. But then we also have to accept the fact that actually I'm seeing that improvement now. But then I think our health space was really suffering. We have to accept it. And also with that comparison, of course, you've said one was a private and the other one was more of a trust.
It's all private.
It's all private.
They're all considered private.
So we get, with that notion of us still thinking private is, more money or anything, the way you had defined it, still private to us looks more, appealing. Looks more, and which also gives us a notion that this is going to be super expensive. I'm speaking as that person who you were like, we're like, yeah, this hospital is clean. No, to be honest, back then, and we would visit a hospital from the gate, there would be a stench. There's
a hospital smell.
You will start remembering, start saying, actually, I wasn't so sick, but now I'm feeling sicker. We even get to people to be so traumatized that then they'll be like, you tell them, let's go to the hospital so that you can get checked. They're like, medicine and all that. And this, of course, stems from, I'm really sorry, public hospitals. They were not really well kept. The numbers were low. You get that even the ratio of a nurse or a doctor to a patient is so beds. People are, sharing a bed. And of course, that will lead the environment not to be so conducive. And that's why now when we come to the bare minimum of a private hospital looking so well, nobody's sharing a bed, there's bigger spaces, which I believe that's where we should be leading at, in either it being a private or a public or a, So that thought, of course, stems from us, where we came from, our background. And you see, funny enough, hospitals is something that joins us. If you're sick or not, one way or another, you are still carried, even when you didn't know to go to a hospital, get a vaccine for something. So it's it's something that you'll still experience it. And I'm also not speaking of this just to also not touch on the people who are not at the time then able to reach hospitals as well. But then, yes, with those who were able to, that was what we had.
Yes.
Yeah, and that's why private hospitals look more appealing, to be honest.
Yeah.
And it's actually, I've never even made this comment to a private hospital, and that's why I think now my thought, which also shocked you, is for me to tell you that a hospital should be clean.
Yes.
Because it should be.
Yeah.
If it is dirty, health is cleanliness.
Yes.
You need clean water. You need clean food. So if it is not conducive, then how are we to ensure that I'm in a healthy space?
Yeah, exactly.
Plus, if I was to get more a little bit religious, is cleanliness is next to godliness. So that's a bare minimum, and I agree with you on that. I do totally. So I asked for 2 questions.
I've asked both.
Yes. Okay. Yes. Okay. Do you have a question for me? Let me start from there. You're looking at me with a lot of curiosity, and I'm like, okay, shoot, ask it away.
I was just asking your. In my mind, I'm thinking, what haven't you liked about healthcare? From your experience.
Okay, well, there's a lot. There's a lot, of course.
Yes.
Well,
particularly in Kenya.
Yes, actually in Kenya. But then, before I answer it, I'm still going to apologize again.
Yes.
Well, with my view then, and then now getting to understand now the view of the people who are giving the service, well, it becomes a comme ci comme ça kind of situation. But then at first I was, even when it comes to, is it the maternal and child neonatal pediatric, when it comes to now a mother about to, give birth. So I had an experience where I found, I felt like these nurses or the people, it could be a CEO or anyone, really the way they were talking to them, it didn't come to me so right. They're rushing them in some kind of way. And of course I came out to be judgmental. I was like, why all this, But then as much as I'm still a curious person, so when that happens, I will still face you and be like, why would you have to talk to a mother who's almost giving back in a certain manner? The tone is kind of harsh. Of course, there's those who are bad. Let me be fair enough. There are those who do it because that's maybe who they are. But then there are those who, when they explain it to you, you get to understand why there's that need. And at first, of course, how they handle, that was one thing I didn't like. Now, to answer your question. But now on this other part, I became curious to really understand why this happens. And just to come back now to workforce, you get to understand even the ratio of the nurses. And then, there are many mothers maybe there who are almost in the line. I got to understand there's a line where they maybe have to go to theater to bed. And you find that now this is the explanation I got now from who was genuine. The harshness was not coming from a place of frustration. Okay, they might be frustrated, but then you find that they have to deal with a big number of women, but then maybe one is sluggish. And if you have to become, that's what being a nurse means, or being a medical practitioner means. But then you find that time and also other people still require the same service. And so for maybe things to move, I have to be in that voice, I have to be in that manner, which someone might really confuse in reckless handling. So when you get to both sides of the story, you get to be a little bit, now what? And it's true, still the ratio is so low. Even when other than just even coming to the maternal and childcare, even just to now the general angle of it, you still find that the ratio is still low. Still find that even a nurse put to bed with a patient we are so far to it. And that was one thing I hated, but then it still had an explanation, a long explanation.
So you're talking about lack of empathy, lack of feeling, empathy, and a feeling of care for the patients is what we in healthcare should actually.
And actually, it's not even only my. Actually, it reminded me of another situation where you get that you've come with a friend. Actually, okay, if I was to define, just have the whole scenario. So I'm taking a friend to hospital. She had cramped their ankle. So the way that nurse received us, you even get sicker. Even like, why did I have to come here in the first place? And for that to happen, it being, I want to mention the hospital, but then it was a huge public respected hospital, and then that's the kind of reception. I tried to get all the excuses possible for her to have treated us that way. Maybe it's overtime, or I don't know. But then,
so one of the big challenges is the fundamental training that healthcare workers get. So if they're trained in resource-constrained environments where they don't have the right equipment, they don't have medicines, they don't have facilities and everything, when they go to work and they're in similar environments, that training is what forms where they'll always work. So one of our biggest challenges in what you are calling private healthcare is how do you, because that's where we hire all our staff from all these public things, this is where they've done the internship and everything. So how do you make these people more patient-centric, more caring, more empathetic? You know, so that to me was one of the biggest things, because I grew up in the age of watching a TV program with George Clooney called ER, and I'd not worked in hospitals. So when you go to hospitals, you find it's opposite. In hospitality, there's a lot more urgency in how quickly you get a cup of tea compared to a hospital. So that's what was the big cultural shift for me, and say, okay, how do we bring back urgency and sense of care within the organizations? It's not easy work. It takes many years, and that's why I told you have to do all that training. And so it's something that is there because soft skills training is missing in most of these training institutions, largely. So they'll have to learn it and pick it up from the workplace. And then you must remember something else, a word which is called healthcare used to be a calling. So people in their heart wanted to be nurses. People want to be priests. They want to be nuns. People are taking professions because that's what brings bread and butter. So once you also understand that it's no longer a calling, and so that's what you've got to also put systems in place, like any other organization, that people are coming. But then,
according to you, do you think we are now like passion driven, or what do you? Because of course you've dealt, there's a part where you mentioned, and actually I felt like I'm in an interview with you, because there's a part where you mentioned, like, I felt like I was in an interview, and I imagined you now doing an interview to someone who's coming to work with you. So do you feel right now, at this moment where we are at in Kenya, do you feel like people are doing things passion driven, or is it more now bend into my needs? What am I getting?
So remember the first question you asked me, what profession did I dream of becoming? You get me? And most people don't end up in the professions they dreamt about. You get me? But the people who will succeed in either healthcare and whatnot are the ones who are passionate about their work. So they're the ones who go to a place where there's no equipment, and they will innovate. They will change. They will look for resources. That's a passion. So you shouldn't worry too much about that, because if people are not passionate, will fall out of the cracks.
Do they?
But the system should be able to, and that's what tends to happen. They will say, this is not my career, it's too dirty, I don't like pain, patients are difficult, and they will slowly, they'll filter out. But what we have to do is prevent the damage they may do when they're there. That's basically what happens in all industries.
So you having led the big changes in healthcare delivery, what is that one strategy that you can share with me that really worked so well?
So one of the things that we learned very early on, remember we're saying most of the premier hospitals in this country, Nairobi, are in the non-profit sector, and they are founded by community. So when you find something in the community, your focus is trying to serve people at almost free services. Why you perceive it as becoming expensive? Because there was an awakening in early 2004, which has continued, and it's causing a shift. When you realize you cannot continue giving services at below the cost it provides you, because you keep making losses and then you'll shut down and close your doors. That's not a long-term sustainable thing. So how are you able to stay competitive in this environment? Yeah, and offering quality services that patients are willing to pay for it. Remember, it's a willingness to pay. Yeah, it's in a competitive space. So people need to be able to learn that what drives people flocking to you is because you're offering quality service. That's what's going to bring people to you. It's not so much the physical infrastructure, nice painted building or clean hospital. People have to trust your facility.
Okay. Now, I know we've touched on the fact that when now we come to, with the example that I had given on what I hated or didn't like. Hate is a big, I hate using that word as much as I've used it in the same statement. It's totally a strong word. Anyway, so you mentioned about now training how to handle patients in a soft manner and maybe in an empathetic manner. So with that thought or that as a solution, because I find it as a solution, what is that for the maybe for the small hospitals or for the hospitals that don't fall in like the private sector, what is that one thing that you would like advise them that they could do better, or you could add them, or maybe they do not even know they have that power?
Kerubo, soft skills is just only part of it. You need competence.
But then, don't you think they're taught in school though?
No. You'd be surprised, because remember, you're being trained in a resource-constrained environment. When you come out here, then you find sophisticated. I'm telling you from the truth. Yeah, and they admit and say, when we were being taught, we didn't have ABCD. So there's a whole. Don't
you think maybe with this conversation, we should try and advocate, if it's not happening yet, that maybe it should be in the curricula?
No, I'm not talking about soft skills training. I'm talking about having competent workforce. Those are two different things.
Yes, those are totally two
different. I'm talking about people who, when they go outside there, they're able to do the job that they're trained to do. Yeah, so if it's very simple, doing dressings correctly, applying the correct medications, having high standards of quality and care, and minimizing harm to patients, and also reducing mortality for the patients. So that's what I call having the primary focus. What is your focus? Well, how can we do everything for the people under our care? So in a big health system like Kenya, it's becomes complex. It can be made overcomplicated, but in the simplest form, I always say work towards standardization. That to me is the biggest thing. Just standardize everything that you do. So if you're running a theater, for instance, just say, okay, why don't we follow the WHO standards for surgical procedures? And then that's standardization. So standardize, and you'll have good outcomes. People will trust you. You'll do less harm. People will not say this hospital, like, oh, they're going to die. You standardize even medications that you give. And you say, this is what you give for this, and that's what you give us. And you stay with it, And so you shouldn't struggle too much. So like I say, the challenge in healthcare is variability of service. So you find an excellent physician, an excellent nurse, next one day. Next day you come, you meet the opposite. So how do we make service less variable?
How do we make service less variable? I'm trying that question to you.
That's by standardization.
Do you believe we will once get there?
We will, and we can. Yeah.
Okay. Because you did touch on competence, and
so
when you mentioned that one, I was like.
So one of the biggest things that we don't talk about a lot in Kenya is attrition of the workers who are trained. We train a good number, but we don't retain them in the provision of healthcare. So, for instance, today when I was coming, I met somebody who's a professor who was very skilled in neonatology, but I knew him. And I met him, so, Doc, do you have your practice here? And he laughed, and he says, I don't practice anymore. I'm doing more research. So there's a lot of attrition of healthcare workforce, and then we have a global competition. Yeah, so we train very well in this country, despite what I've said, but we train very well. And those candidates, there's a global shortage of healthcare workers. So there is a huge transfer of skills outside Kenya. So the pipeline, you always have to have this pipeline of people coming in, people leaving, and people going to do other things outside what they're primarily trained in. That's usually a big challenge.
Do you have a question for me?
I do. So you have children?
Not yet.
Not yet. And how many would you like to have? 2,
if more than that, 3.
Oh, and what's the reason behind that?
Well, getting to just sustain a whole family. If you're too many, okay, I do believe in the saying that mtoto huja na sahani yake, but then, for quality, if I have too many, I believe myself, of course it's a decision I have to make. I wouldn't give them quality life or quality education, but if I have 2 to 3, I feel like that's manageable when I've made the decision that I want them, I welcome them, and of course they didn't choose to come to a life which is me frustrating them and me not reaching to their needs. Plus I also have a whole belief around when I'm still alive and my kids are there, even when they're 86 and I'm alive, I'm still responsible for them. So if they have to call me mom and I'm 120 years and like, mom, I cannot do this, I still have to get a solution for them because I'm still the mother.
So what would you worry about their healthcare? When you have children?
Misinformation and lack of awareness, which I feel like it's something that really cuts across a lot of citizens. I don't want to call patients, but citizens, because we get that many people can be suffering from something that if they met a doctor way earlier, should have been solved even with just maybe the consultation fee. Because also we've pegged healthcare service with money. So even when someone thinks about hospitals, like, hey, we start thinking of the consultation fee, we start thinking of the medicine, we start thinking of just what the doctor is going to tell me. Maybe it's a whole, and I feel when we get to converse around these things, we get to have, a central understanding that you being unwell is just not about consultation fee and all that. You might even get a good.
So you're worried about cost of healthcare?
No, misinformation and lack of awareness.
But what you said is more to do with cost.
Yes, it is.
So my question
because of misinformation.
What misinformation?
Okay.
In health, in particular. So let me just make your work easy.
Okay.
What's your view about vaccination? Whether for females or children?
Well, funny enough, I've done a story around that just recently.
Yes.
But then I've done it just around baby and newborn vaccination and screening. But then, of course, now you're turning it down to female and you've said female and?
There's a lot of
there's a lot of time, but then yes.
And
actually even specifying it that way, it's taking me to, is it the HPV one?
HPV vaccines and all this, yeah.
So
and even COVID and even childhood vaccines.
Well, this is my take. Let me be honest. Yes. You get that we have these standards and policies that are made around vaccination that maybe a certain age set has to use it, and you even find that as much as that's the ones who need them, we have a whole lot of group which is not inclusive in these policies and these standards or these rules that are made around them, and that ends up even having the medicines not used or even expire.
So access. You're talking about
there's access.
There's a challenge. You say vaccinate, but the vaccines are not available at the point of care, so people don't get those vaccines.
Or, and the other way around, they are, but then they're just limited to the wrong group, which comes in the fact that, yes, we have policymakers which make really great regulations around this and really great policies. But then at the same time, they can also be hurtful. We have to accept that.
That's I'm still coming to misinformation. Is there a need to vaccinate?
Yes, there is need.
But there's a big move globally.
Yes, there's a big move globally.
And the conspiracy theories.
Of course. No, okay, you have to understand, especially when we come just to Africa. We have a lot of societal cultural, even on just on down to like the HPV, even boys do need the vaccine, let's be honest. It may entirely suffer on the girl child, but it's something that can still cut across all gender.
No, you're just saying that basically there's no equity and focus on vaccines. It's the focus is more on the female gender to be able to bear the brunt of the vaccines and the so-called side effects, whatever it is.
Yeah.
While in the way the HPV you're talking about is as a result of the two genders coming together.
Yes.
And so the males bear an equal responsibility to as well.
Yes, they do.
In that particular case. But anyway, so I was just trying to get your views as a young person about.
And what do you think?
There's a lot of. I grew up in an area where I'm sure you've seen people with the disabilities of the foot and whatnot, and it's caused by polio.
Polio, yeah.
Yeah, which a lot of people don't see. So people say don't vaccinate. I've worked in also an extremely poor country where there are more visible people because of war and other things that they have not been vaccinated. So you find people are physically disabled because they are not vaccinated.
Which actually on that same note, other than just specifying to just HPV, which again just takes me around now, still policy and still the regulatory board around all that, you find that these are needful medicine, right?
Yes.
But then maybe where they're taken, they're not entirely needed. And maybe what's needed there is now in scarcity. But then now another county, because now currently we are now dealing with county level. So you find that maybe this county you may be dispensing equal amounts of this medicine. But then maybe you're not taking account of what is this county or what is this location or this geographical.
What are the needs?
Exactly, and now we get that
on the different
many medicine go unused. Exactly, they go unused, and for the fact that there's just a regulation, or maybe this is how it's supposed to be done, or how this is how it's supposed to reach the society and all that. But then we still get to have a lot of minus. Yeah. And thank you so much for sharing your personal journey in leadership, your experiences, you managing all that. For the next session, we're going to touch on policy, service, and the healthcare in whole now. I know we've already.
You won't get my perspective and perceptions.
Yes.
Of what's happening.
Yes.
Okay.
Yes. I hope to see you in the next episode where we get to learn and chit chat more with. I almost called you Doctor.
Gordon.
Yes.